I'm a psychiatrist and I'm a psychoanalyst. And before coming to Austen Riggs, I lived and practiced in Houston for 15 years. Worked in the Department of Psychiatry at Baylor College of Medicine. Had an outpatient practice, psychotherapy, medication, psychoanalysis. And part of what was attractive about the idea of coming to Riggs is finding a place that valued my identity both as a psychiatrist and as a psychoanalyst. I've always had a primary interest in psychotherapy and psychodynamic understanding of patients' difficulties, and I've always wanted to understand people in terms of their lives as individuals, the development of a person as an individual throughout their life course. So I've always tried to keep medication in my mind in that context. But it is very different being a prescriber here than being a prescriber in a conventional outpatient or hospital setting elsewhere, in that there's an expectation here of integrating the psychodynamic model in one's thinking as a prescriber. So for instance, the other day I was bringing a question about medication to my fellow group of prescribers. I was saying, what do you guys think about this? What changes can I make for this person? She's really dissatisfied with this aspect of her medication. What have you guys tried? And in most settings, the kind of answer that you get to that is, well, what about this medication? What about this medication? Have you tried that? This has good results. And, we did a little bit of that, but the overall outcome was that the group said, there are some issues to take up in the transference about how the patient is tolerating negative experiences and bring that into therapy, and how the medication is being used to manage that. And that's, a very novel experience for me as a psychiatrist.